Diabetes Action Canada, a pan-Canadian research organization dedicated to improving the lives of persons living with diabetes, has developed a National Diabetes Repository, or NDR, which contains de-identified clinical data about diabetes patients. Diabetes Action Canada hopes to link the NDR data with administrative data, or outcomes data, in order to identify patients at high risk for diabetes complications, such as blindness or foot disease necessitating amputation, and implement targeted intervention and treatment measures. The COVID-19 pandemic has repeatedly shed light on the shortfalls of the Canadian health data landscape. There's a disconnect between research and care. Diabetes Action Canada can flag patients at high risk for complications. However, privacy legislation prevents the organization from identifying or proactively reaching out to those patients. Data is also often housed in data islands or silos with different institutions where organizational policies limit the permissible use and disclosure of the data. What is considered personal health information also varies from province to province. These shortfalls render Diabetes Action Canada unable to fully measure the impact of diabetes on the Canadian population and provide timely interventions for high-risk individuals. Privacy remains a foundational pillar of the NDR and Diabetes Action Canada's initiatives broadly. Diabetes Action Canada cannot share personal health information with other entities unless the initiative falls under a disclosure exception set out in the legislation. In order to be able to link its data with administrative data, Diabetes Action Canada must become a prescribed organization that maintains a health data registry. While there are provisions that allow researchers to share health data for research purposes without prior patient consent, these schemes do not fit Diabetes Action Canada's research model. 3 privacy law reforms would benefit Diabetes Action Canada. First, all provinces should enact uniform legislative schemes that designate certain organizations that maintain health information registries and allow for data linking or matching. Second, provinces should clearly explain how an organization can become a prescribed organization that maintains a health information registry. Currently, the process for being designated such an organization is opaque and unclear. Third, provinces should provide more guidance on how to define personal health information in the health data context. This will allow health research organizations to know more clearly how provincial privacy legislation applies to their data, and specifically whether it applies to data that has been safeguarded through methods like encryption or hashing. Ultimately, Diabetes Action Canada hopes for a privacy law reform that will both protect sensitive patient medical information and allow researchers to leverage patient data in order to improve primary care and prevent chronic disease complications.